Hello, welcome back to Learn Anatomy with Dr. Vessel. Today we'll be continuing with our series on ossification of upper limb bone, and this will be the part 2 of this series. In part 1, we looked at definition of ossification, type of ossification, and of ossification centers. In this part 2, we'll be looking at general rules of ossification, and we'll look at just one bone, ossification of just one bone. Now, what are the general rules of ossification? The first rule of ossification is that the primary centers appear intrauterine life. The primary center appear intrauterine life, and it occurs around week 7 to 12 of intrauterine life when this child is still in the womb of the mother. That's where the primary center appears. Now, the secondary center appears, or the secondary center appears after birth. The secondary centers appear after birth. You need to know that there's exceptions to this. The distal femur and the proximal tibia does not follow this rule. When I will be teaching ossification of the lower limb, I will explain this further. Now, the growing end of a bone appears earlier and fused later, with the fibula as an exception. The fibula does not follow this rule. Other long bones follow this rule except the fibula. Now, I want to remind you of the mnemonic I talked before in my previous video, where I said the best way to remember that the primary center appears in intrauterine life is using primary center appears before pregnancy ends. Now, the PA and the PA will help you to remember that primary center appears before pregnancy ends. Why for secondary center? I give you a simple mnemonic which is secondary center appears at the start of life. So the S here and the S here can help you remember that the secondary center appear at the start of life. Now, the next thing I want to talk about is this. As you can see, you observe that the new joint does not obey the rules of ossification. The knee joint does not obey the rule of ossification. Not the knee joint itself, but structures around the knee joint. If this is the knee joint, for example, if this is a sketch of a knee joint, for example, this is the femur, this is the tibia, this is the fibula. Now, the distal part of the femur, which is around the knee joint, the proximal part of the tibia, which is around the knee joint, does not obey this rule of ossification that secondary centers appear after birth, because its own center appear intrauterine life. So you must take note of that. Now, the growing end appears earlier and fused later. The fibula does not obey that rule. So if you think of the joint does not obey the rule of ossification, it will help you remember that the distal end of the femur and the proximal end of the tibia does not obey the rule of secondary ossification, while the fibula does not obey the rule of the growing end of a bone. Now, let's look at ossification of individual upper limb bone, and in this video I will not be talking about the clavicle. Now, you can also remember, if you want to remember things about the clavicle, that Dr. Vessel taught the clavicle alone because clavicle is very special, and I'll be showing you why the clavicle is very, very special. Now, the clavicle, first off, is that it does not undergo cartilaginous ossification. It does not undergo cartilaginous or intracartilaginous or endochondral ossification. It undergoes membranous ossification. It's one of the long bone that undergoes membranous ossification. Now, there's a mnemonic I want to introduce in this video, but I will explain it detailed I will explain the mnemonic in detail in the video of the clavicular bone. Now, this mnemonic is most clavicle. Most clavicle. I will not be teaching you the meaning of MO here. If you want to know the complete meaning of the mnemonic, you have to watch the video of the clavicle. Now, this MO here shows that the clavicle have membranous what? Membranous ossification with the medial end as an exception. So the medial end of the clavicle does not ossify through membranous ossification. The medial end of the clavicle, but all the clavicle, other part of the clavicle, ossifies through membranous ossification. So you must take note of this, and that's why in this statement it said mostly membranous, because it is not all part of the clavicle that undergo membranous ossification. The medial end of the clavicle undergo what? Endochondral or intraclavicular intracartilaginous ossification. So that's why this statement is here. Now, the next statement is that it is the first to ossify. You must know that the clavicle is the first bone to ossify. In this part of the video, I told you that the primary center appears in 7 to 12 weeks. But for the case of the clavicle appears around the 5th to 6th weeks of intrauterine life. So it is the first bone to ossify, and it is also the last bone to fuse. So you will get to learn this when I discuss about the clavicle in detail. Now, the second thing is that it has 2 primary centers. Clavicle is very special, as I told you. It has 2 primary centers. It is the only long bone that has 2 primary centers. It has 1 secondary center. It can also have 2 secondary centers, but mostly it has 1 secondary center. Now, how do I remember the location of these centers? The primary center is located in the diaphysis, while the secondary center is located in the epiphysis. And remember, in our last video, we used secondary SE, the two first letters in the word secondary, to remember that the secondary center is seen in the epiphysis, that forms the epiphysis. So the secondary center is located in the epiphysis, while the primary center is located in the diaphysis. Now, for the clavicle, the secondary center is seen in the medial part. It's seen in the medial part. That part that does not undergo membranous ossification. That is where you see the secondary center. And the medial part is the part closer to the spine. And some of the structure closer to the spine is the sternum. So you can either call it the medial part of the clavicle or the sternal part of the clavicle. Either the medial part of the clavicle or the sternal part of the clavicle. Now, for proper ossification, look at it. It's located in the diaphysis of the long bone. Right? Now, that is what I want to explain to you. Now, I've told you, you must always remember that I discussed clavicle alone because it is very special. It undergoes membranous ossification. It has 2 primary centers. It has 1 secondary center located at the medial end or the sternal end. And from this mnemonic I gave you, the medial end is the only end that does not ossify through membranous ossification. I have come to the end of part 2 of ossification of the upper limb bone. In the next video, I'll be discussing about other upper limb bone. Thank you for watching.